Hi everyone, and welcome to Metzger Vet Academy. My name is Rachel, and today we're going to teach you how to diagnose some common diseases of dairy cows. So we'll go through LDAs and RDAs, as well as some other common off-feed fresh cow issues, and that way you'll feel a bit more confident to determine whether or not this is a problem you can treat yourself, or if it's a problem that you have to call the vet for. Fresh cows off feed are a pretty common issue that dairy vets get called out to on farm. Many of these cows will end up being LDAs and they need to be fixed with a surgery or a toggle procedure, but there's quite a few cows that end up being something else that can be treated on farm with good protocols. So we'll help you be more confident in your diagnosis of some of these issues. Many farmers are pretty confident diagnosing an LDA, or a left displaced abomasum, or a twisted stomach you might hear it called. But we find as vets it can be a lot trickier for farmers to diagnose an RDA because they're not as common. That's when the stomach is twisted to the right on a dairy cow. So what we'll do in this video is we'll review how to diagnose an LDA. We'll give you some extra tips and tricks on how to diagnose an RDA properly and be very confident with your diagnosis. And then we'll also give you some things to look for in the event that you don't find an LDA or an RDA. And we'll kind of teach you what else to look for so that you can find a diagnosis even when it isn't something as obvious. Obviously, there are a lot of different diseases that dairy cows can get on farm. So in this video, we're not going to tackle every single problem that they might see, but we are going to go through some of the most common ones. Additionally, we're not going to give you treatment recommendations. We're just going to help you diagnose diseases confidently. At Metzger Vet, we like to give out protocol books like this to our clients. So they'll go through treatment protocols for common diseases so that if you're not sure what to treat a cow with when you've diagnosed her, you can have some backup by looking through the book. So we recommend that you work with your regular vet to develop protocols if you're going to be diagnosing some more disease yourself. But we're going to focus in this video on just helping you diagnose diseases confidently. So how this video is going to work is we will walk you through a physical exam on a cow. So we'll go through all the major body systems that you would inspect when you're doing a physical exam, and then we'll teach you what's normal and what's abnormal. And once you learn what's normal and abnormal, you will be a lot more confident to be able to diagnose what is going wrong with a cow. Obviously, with a physical exam, you're not going to find anything that you don't look for. So if your full physical exam on a cow consists of pinging that left side and looking for an LDA, and you don't look for anything else, you're going to potentially miss a lot of diagnoses. For example, if you ping that left side, you found that gas, you're confident that she's got an LDA, but you fail to check the color of the manure, or you fail to check the color of her vulva, you might actually miss the fact that she's got black manure and she's super pale, indicating that she's got a stomach ulcer. So we're going to walk you through a full physical exam, help you not to miss things, and that way you'll be able to make the best diagnosis for that cow, and you'll be able to make the best treatment plan for that cow going forward as well. Let's get started by going through some equipment that you'll want to have on hand in order to complete a full physical exam. Now we'll go through some pointers of how to conduct a physical exam, and we'll start with some of the most common things that people want to know: how to diagnose a left and a right displaced abomasum. First things first, when you're going to use a stethoscope, make sure you've got the earpieces pointing the right way. They should be angled forward so that they sit comfortably in your ears. The left side of the animal is where the rumen sits, and it's also where you can find a left displaced abomasum in a sick cow. We'll start by pinging the left side of the animal to look for gas. You'll want to place your stethoscope in between the ribs so that you can actually hear for gas. And once you've got that stethoscope in place, you can flick the animal firmly or firmly hit the side of the animal with the open hand. Both movements can effectively elicit a ping if there is gas to be found. And if you're not having success with one technique, feel free to use the other. There are different types of ping sounds and different locations where you can hear those pings. A true gas ping, like that of an LDA, should sound like a basketball bouncing on concrete. It will be high-pitched and the air will sound tight. You can also hear lower pong sounds, like someone hitting a beach ball, and those are typically indicative of rumen gas. Location of the ping is also very important. If you hear a high-pitched gas ping clearly across 2 to 3 rib spaces on the left side, you are likely dealing with an LDA. If you hear a pong or gas sound underneath the short ribs and behind the last rib, it is more likely a rumen gas ping because that is where the rumen sits. The next thing you'll want to check on the left side is how the rumen sounds. Many people will be able to use rumination monitors to see how well a cow is ruminating, but if you don't have that, you can also listen to the rumen here. You can expect a healthy rumen to roll 2 to 3 times per minute. While you're listening to the rumen, you can take a look at the rumen fill to see if the animal has been eating well. A healthy animal will have good rumen fill in the area below the short ribs and behind the last rib. Another thing to watch out for is distension on the left side. Dramatic gassy distension under the short ribs and behind the last rib can indicate bloat. Mild distension of the ribs towards the outside of the animal can indicate an LDA, as a gas-filled abomasum on the left can displace the ribs laterally. The right side of the cow's abdomen is where you can find the intestines, the cecum, and a right displacement. When pinging this side of the animal for gas, the same rules apply as when you are listening for gas on the left. Place your stethoscope in between the ribs and make sure to listen for gas in lots of different areas, not just in the middle. An RDA ping will sound like a tight, high-pitched ping, just like an LDA. To confidently diagnose an RDA or an RTA, you will need to be able to find gas across 3 rib spaces. Intestines in an off-feed cow will often contain some gas, so it is not uncommon to hear gas on the right side of the animal, even if she is not displaced. Keep in mind that the intestines sit towards the last rib and below the short ribs. It will be the area that I am listening to here in the video. Not all the gas that you hear in this area is an RDA, so be careful to pay attention to the gas location and the gas pitch. RDA gas will be located across 3 rib spaces and will be concentrated underneath the ribs. Intestinal gas is usually behind the ribs where I'm listening now, and sometimes when you listen closely to an animal that has very gassy intestines, you can even hear them churning. The cecum is also on the right side of the cow, and if a cow has a twisted cecum, you will hear gas directly below the short rib and behind the last rib. You will also be able to feel a big cecum rectally on the right if she has a twisted cecum. Twisted cecums are a very serious emergency and the cow will be very sick if she has one, but they are also pretty rare to come across. To listen to the heart properly, you'll have to get your stethoscope underneath the cow's elbow. A normal heart rate is 45 to 85 beats per minute and has a lub-dub rhythm. A heart rate that is very fast can indicate that the animal is stressed. This stress can be caused because she's been running around a pen when you tried to catch her, it can be caused because she has a twisted stomach, or it can be stressed simply because it's hot outside. It's not a specific diagnosis. If this is a cow that has just calved and she is down with milk fever, the low calcium in the blood can also cause a high heart rate. An animal with a low heart rate might be suffering from shock, blood loss, or heart failure. It is more common to see an elevated heart rate than one that is too low. Another heart abnormality is when the heartbeat does not sound like the classic lub-dub. In serious cases of hardware or heart failure, the heart can start to sound more like a washing machine where it is very difficult to pick out the normal rhythm. Heart abnormalities can also sound like extra sounds in addition to the normal lub-dub. In either case, if the heart does not have a normal lub-dub rhythm, there is usually something going on that is very serious. The lung field in the animal is located here. This is where you'll want to listen to hear lung sounds. The main disease we're looking for when listening to the lungs is pneumonia, but pneumonia can be more accurately diagnosed from other symptoms such as heavy breathing, fever, nasal discharge, coughing, and rapid respiration. Listening to the lungs is just a confirmatory step. Healthy cows will take 15 to 50 breaths per minute, and a respiration rate above that is generally considered abnormal. When you're listening to the lungs of a healthy cow, you should hear gentle air movement and gentle breath sounds as the cow inhales and exhales. Any harsh, scratchy noises are a problem. Same with any crackles, pops, or wheezes. These all indicate lung damage from either an ongoing pneumonia or a past pneumonia. A rectal exam should consist of taking the cow's temperature and then examining the reproductive tract, rumen, and manure with a gloved arm. A normal, healthy cow in a cool environment should have a temperature anywhere from 38 to 39.3 degrees Celsius. When doing a rectal exam, you should check the cow's manure consistency. A healthy cow will have some manure present, and the consistency should not be too runny and not too firm. The color should also be a typical brown. Abnormalities like watery manure, dry or firm manure, or off-color manure can indicate some kind of issue with the digestive tract. If you come across a cow with no manure present at all, you should consider it likely that she has some kind of upstream blockage. That can be a twisted stomach that cuts off the movement of food, or a blockage in the intestines. If you come across black manure, you should always have a stomach ulcer as your main diagnosis. Another thing to keep in mind during a rectal exam is uterus size. If a cow has calved 5 to 6 days ago, the uterus should have involuted significantly since calving. If the uterus is still very distended, it might be a sign of a problem. On the other hand, if a cow is supposed to be 100 days pregnant and the majority of the uterus fits in your hand, you should be concerned that she's aborted. Keep in mind the cow's reproductive status and make sure that the uterus correlates with what you expect to find. Also pay attention to any discharge from the uterus. If a cow is a few days fresh, you should not be seeing a copious amount of stinky red-brown discharge coming out of the uterus when you do a rectal exam. That would be a sign of metritis. A vaginal exam can be conducted with a clean gloved hand if a cow is very fresh. This will help you determine if the cow has any tearing or traumatic calving injuries, or if she has any pieces of placenta that are retained internally. It is also not unheard of for a farmer to find a dead twin inside of a sick cow a day or two after her initial calving. If a cow is more than a few days fresh, checking the color of her vulva is sufficient. The vulva should be pink and not pale. A white pale vulva is indicative of severe blood loss from something like an injury or a stomach ulcer. The cow's eyes should be clear, alert, and bright. If they are sunken in, you'll want to find out why the cow is sick by finishing the rest of the physical exam. If the eyes are bulging, that can also be a problem. An eye bulging on one side in an older cow is commonly associated with cancer when there is a tumor behind the eye. A normal nose will have no discharge or a mild amount of clear discharge. An abnormal nose will have white, thick discharge and should make you think of pneumonia. All dairy farmers will already know how to diagnose mastitis, but we want to bring up the udder when talking about diagnosing sick cows because sometimes as vets, we get called out to treat a sick cow and it turns out that she has mastitis, but for some reason the farmer or the employees simply didn't look. This is an easy disease to eliminate when diagnosing a sick cow, and it is an easy disease to develop treatment protocols for on-farm. Watery, lumpy milk, or a swollen red and tender udder are all signs of mastitis. One last but very important thing to check for in a sick cow are ketones. You can check ketones with blood or milk samples. Ketosis is a gateway disease that predisposes animals to lots of other diseases. It is also a very common disease of fresh cows. If ketosis is diagnosed and treated early, subsequent diseases like LDAs can be prevented and steps can be taken to prevent ketosis in future animals when you recognize it on a group level. Many farms will screen for ketosis in their fresh cow programs. Taking blood is the most accurate way to diagnose ketosis on an individual cow basis. If you want to learn how to take blood, take a look at our blood sampling video for some tips. We use the Freestyle Libro machine and Precision Extra test strips to test for ketosis. The black and white end of the strip goes into the machine, and when it prompts you, apply the blood to the end. Once you put that drop on the end of the strip, the machine will read the ketone level for you. A reading of 1.2 or higher indicates that the cow is ketotic. Testing with milk is even simpler and involves taking a keto test strip, squirting milk onto the end, and then waiting 1 minute to see what color the strip turns. A strip that turns purple indicates a ketotic cow. Hopefully this video has given you a lot more confidence to be able to diagnose common diseases on your farm. Remember, when you've got a sick cow, don't necessarily stop that physical exam at the initial diagnosis, but make sure you look for all the things that might be going wrong with that cow, and that way you can make the best treatment plan for her going forward. Remember that when you're looking at a sick cow, there's no need to rush through your physical exam. Take your time, even if there's someone looking over your shoulder. You might be surprised by what you find when you complete a full physical exam. When you have the best diagnosis possible, it's going to improve your treatment success as well because there won't be a disease that you missed. So remember, do a full physical exam, look for everything that might be going wrong, and that will increase your chance of success when you're treating that animal. If there's any topics that you'd like us to go through in future videos, please feel free to reach out and let us know. Our contact info is all at the end of the video. That's all for now. So next time you have a sick cow on farm, remember to get those gloves dirty.